The doctor is in. Once again, I got to give a huge shout out. We have, like, it's a ghost town in the station. So many people are not here. But again, a shout out to my crew that always works so hard, my producer getting folks still connected to us any way she can. And I just want to say to everybody working hard here, we are very thankful. So Dr. Bethany Cox Snider joining us, Chief Medical Officer, Hosparus Health. Dr. Bethany, I know you were here right when all of this coronavirus began to, I don't even know, we didn't know much about it, and news conferences, press conferences, and we weren't able to have you on. So thank you for coming back and making sure folks have the information that they need. We thank you for that.
No, thank you for having me back. I appreciate your kindness.
Absolutely. No, we appreciate you. Okay, really quickly, because we've got a caller on hold, maybe a couple of callers on hold. Let me remind you, again, you can call whatever questions you might have for Dr. Bethany Cox Snider from Hosparus. The number's 502-571-5263. Probably going real fast there. Sorry, there it is. 1-888-800-9283. We're going to go to Harrison here in a second, but really quickly, explain Hosparus and the important services that you give us here in Wave Country.
Absolutely. So Hosparus Health is a not-for-profit organization providing community-based hospice and palliative care to Kentuckiana. We serve 41 counties in southern Indiana and Kentucky, and we really go to meet families wherever they call home to support them through serious and advanced illness. And that involves an interdisciplinary team of nurses, social workers, chaplains, physicians, volunteers, CNAs that all wrap our services around a patient and family when they're facing difficult times.
Yeah, let me say to any caregiver, you got to take care of yourself. This team can answer questions and they know what to do, and we just appreciate that. Let's take a call and see if we can connect everybody via all the technology we have here. Harrison, how can we help you and your family today?
Hi, yes, thank you for taking my call, first of all. So, Doctor, I'm going to see, well, first, I went to see my grandmother a couple weeks ago. She is around 71, so she is elderly. So, and I'm also going to go see her on around Easter. Is it okay for me to go see her? I'm perfectly fine, but I want to make sure that she's going to be okay if we do have something that we don't know about or something like that.
That's a good question, Harrison. What do you say, Doc?
So I think that's a great question. And honestly, I would encourage anybody that has family members that are in that high-risk group, which, to remind everybody, is over 60 or with chronic conditions such as heart, lung, and kidney disease, that virtual connection is probably going to be the safest for them if you don't already reside in their home. And so I know right now it's so inconvenient and it's hard and it's challenging, but just for everybody's safety, I would recommend that we try to do virtual connections. So whether that's telephone or video support like we're doing now, that would absolutely be in her best interest, just to try to protect her as much as we can, because we don't recognize how many surfaces we touch or things that we interact with that could be carrying the virus that we might be able to take into someone else's home.
And again, we don't know everything about coronavirus, but we do know that some people are asymptomatic. Maybe they have it and all they have is a runny nose, if that. So you don't want to take that into somebody who won't be able to fight it off.
Absolutely. That's exactly correct, Dawn.
Okay. Let's go to Susie, who has a question now for Dr. Bethany. Susie, what's your question?
Hi. My question is okay, let's say that you have someone you've been with and they put them in quarantine, okay? But you haven't seen this person for, let's say, a week. How far in advance do we need to be away from them before we consider the possibility? We're quarantining in our house anyway somewhat. And I'm just saying, if I saw this person 5 days ago and they've had problems, how long in advance do you need to be away from someone?
So, to reemphasize what Dawn said, there's so much we don't yet know about the virus. But what I would say is we know when people start exhibiting symptoms, that's when it's the highest risk for transmission to someone else. So if it's not someone that you live with, right, if they're not in your home, I would say whenever they developed symptoms was when it was most at risk for them to transmit that virus. And so staying away for them through the symptom course until that resolves, or we say around 14 days after they've expressed the illness would be safest. It's hard to know before they express symptoms how much they were shedding or how much risk there was to other people that they may have encountered. And so what I will hit home is good hand hygiene is so important, and generally we don't do a great job. So do the smart things. If you think someone is ill or they're displaying signs of illness and it's not critical to need to go to the hospital, I would encourage them to quarantine and self-isolate. And just always remember to wipe down surfaces every day, multiple times a day, to try to prevent the virus from living on things that we come in contact with.
As we've been saying, we don't know a lot about it. We don't know like how long the person may be infectious before they start showing signs. Should we just say that if you don't live with that person, then call them? You don't need to be going to anybody's house right now. Only go to the store when you need. I mean, we've been saying this. So if this is not you got to see that person right now, see him when all this is over. Yeah?
Absolutely, Dawn. So we are social people, and I appreciate how hard this is, but we need to be creative in thinking about how we can still meet those needs and provide that self-care and that self-interaction that we all need without being in person. I hope that we look back months from now and say, man, that seemed like we were too aggressive and that was too much change in our behavior, because that will mean we were successful. And right now we just need to think about others over self, right? And so by thinking about others, particularly those high-risk groups, the best thing we can do is stay home, only go out for essential things like getting food. If you do care for an elderly or an at-risk patient, please do those activities for them. So go get their medicines, go get their food, and then come back home. But I would encourage you to not go to homes that you don't live in or interact with people that you don't have to during this time, so that we can truly flatten the curve, as they say, and make sure that we protect each other. Like, this is all about protecting our neighbors and protecting our loved ones, and that's the best way to do that.
I'm going to tell you, I see my kids at least 3 to 4 times a week, and I've not seen them because they're protecting me. I'm high risk with all my chronic diseases. My youngest son has been going to work. My other 2 no, but they're like, Mama, we'll see you when this is done. And so let's get off that subject because I'll start crying. Let's go to Chrissy, but we can do this. We can do this. I know they're protecting me and I have to protect them. Chrissy, what is what's your question or your comment for the doctor?
Hi, my mother is in a nursing home.
Go ahead.
And, okay, sorry. And she's under hospice care, and the nursing home has denied entry to the nurse. And this upsets me a great deal because my hospice nurse is kind of my safety net to protect my mother, make sure she's getting her meds, that I cannot feel comfort that she's getting them from the nursing home staff. What do I do?
So the first thing I would say is thank you for allowing us to walk through this journey with your family and with you. It's a tough time, right? Like, it's so hard to know what's in the best interest of the patient. And we absolutely want to continue to be able to serve anyone and everyone that needs us. And I can assure you that we're working on those examples to try to find ways to, meet those facilities halfway and make sure that we can continue to support our family as well as you, but also ensure that they're getting access to the hospice care that everybody deserves and is entitled to. So I would just encourage you to continue to reach out with us and know that we are working with all these facilities to ensure that we do have access to our patients so that we can continue to provide that high quality care. And that's why we are launching virtual care in a similar fashion to most health systems, so that we continue to have that connection in a way that can keep them safe.
Dr. Bethany Cox Snider, we thank you for being with us. Again, hosparushealth.org. You see that on the screen. The number for them, 1-800-264-0521. We thank you for making the end of life a part of life that is just as special. Anything else you need to make sure we know about hospice or anything we can do? I
would say the greatest misconception is that we are only to be around for days. and we are here to help people for months and years. And so if you are facing a serious illness or you're caring with someone that's having a difficult time taking care of themselves, please just reach out, because I assure you we're here to create more moments to make life the best that it can be for however long it can be. So we appreciate you all giving us this platform to talk to the community.
Thank you. Thank you so much. There you go. The answers. Got some questions